All right, let's dive into something you probably take for granted every single day until, well, it starts to hurt. Your elbow. In this explainer, we're going to break down just how this incredible joint works, what happens when things go wrong, and why it's so much more than just a simple hinge. You know, it's funny. We tend to overlook the elbow. We think of the shoulder as this big powerhouse that gets our arm in the general area, and the hand as the artist doing all the delicate stuff. But the elbow? The elbow is the crucial, hard-working link in the middle. It's the master positioner that gets your hand exactly where it needs to be for everything you do. And look, this quote really nails it. The elbow is constantly making these tiny, unconscious adjustments in height and length. Think about it, lifting your coffee, turning a key, catching a ball. None of that happens without your elbow being the true unsung hero of the arm. So what gives the elbow its incredible versatility? Well, here's the secret. Your elbow isn't just one joint. Nope. It's actually a super complex system of 3 distinct joints, all wrapped up together, working like a perfectly coordinated team. This table really shows the brilliant division of labor going on in there. You've got the ulnohumeral joint, which is your main hinge, the real workhorse for stability, but then you've got the other two, and they add the absolutely critical ability to pivot and twist your forearm. It's teamwork at its finest. So this team of 3 gives the elbow 2 fundamental types of movement. And these 2 motions, the basic hinge and the twist, they are literally the building blocks for almost everything we do with our arms. On one side, you have that simple hinge motion, right? Flexion and extension. That's what lets you reach out for something or bring food to your mouth. But on the other side, you've got the twist, supination and pronation. That's how you turn a doorknob or how you hold a fork correctly in the first place. You absolutely have to have both, working together perfectly. Okay, here's a fun little thing to notice. If you just stand up and let your arms hang by your sides, palms facing forward, you'll see they don't actually form a perfectly straight line. And there's a really cool reason for that. It's a design feature built right into our anatomy. This is just a brilliant example of how our bodies are built for efficient movement. It's called the carrying angle, and its purpose is actually super simple. It lets your arms swing freely when you walk without constantly banging against your hips. That little angle? Totally normal and incredibly smart design. So just how much of an angle are we talking about here? Well, for men, it's typically somewhere between 11 and 14 degrees. For women, it's a little bit more, around 13 to 16 degrees. It's subtle, for sure, but it's a really important piece of our skeletal architecture. Of course, with all this complexity and the constant stress it's under, the elbow can definitely run into trouble. So let's look at 2 really common but very different problems. One comes from chronic overuse and the other from a more traumatic overload. First up, the infamous tennis elbow. And let me tell you, it is not just for tennis players. It's this degenerative thing that's super common in anyone over 35 whose job involves a lot of gripping or wrist work. Think plumbers, painters, heck, even just using a computer mouse all day long. It's the result of all those tiny little strains adding up over time. Now, this is a whole different beast. Valgus instability comes from a massive outward force on the elbow. The classic example, a baseball pitcher. That throwing motion puts an incredible amount of stress on the inner ligaments, stretching them out like old frayed cables. And this can happen from one big traumatic event or just from the repetitive stress of throwing a ball thousands and thousands of times. So let's say you go to a clinician with some serious elbow pain. How in the world do they figure out what's actually wrong? Well, it's basically a piece of detective work. And the first, most important clue is always your story. A good clinician gathers clues from everywhere. They'll start with your story, how did this happen? What do you do for work? Then they'll just look at it, checking for swelling or any obvious issues. They'll have you move your arm and they'll move it for you. And only then will they use specific hands-on tests to really confirm their hunch about what's causing the pain. And that patient story, it provides massive clues. For example, when someone says, yeah, it's this ache right on the bony bump on the outside of my elbow. Well, that just screams tennis elbow. It points the whole investigation in a very specific direction. To really confirm it, a clinician might use a simple maneuver like Cozen's test. Basically, they have you put your arm in a very specific position that tenses up those exact tendons. Then, the examiner adds a little gentle resistance. If that action triggers that familiar pain, bingo, you've pretty much confirmed the source of the problem. So, from its amazing trio of joints to that subtle little carrying angle, the elbow really is a marvel of engineering. It's in this constant balancing act between being stable enough to lift heavy things and mobile enough to do really precise, delicate tasks. Which leaves us with a final thought. What do you think is more important in your life? That rock-solid stability for strength or that fine-tuned mobility for precision? Something to think about.